All right, I think we're good. Welcome everybody to the Community Volunteer Update. We wanted to highlight and really focus in on some of the great work that's been happening already with your help, and wanting to really focus this time on a COVID response. So not necessarily all the volunteer opportunities and all of the options that are out there for making a great impact in our community, but really looking at
I think we're good.
a partnership.
Welcome
with
everybody to the Community Volunteer Update.
We wanted to, sorry about that, wanting to make sure that we have a collaboration between all the volunteers that are wanting to make an effort and wanting to make sure that we're really doing our best work when we're working together. And so the county health department has this great goal that we wanted to emphasize as we start here, that we're always working for a safer, healthier, thriving community, and we're in this together. And so that's where it takes all of us, it takes each of us with our special talents and our different abilities to be able to make a difference. So thank you for coming together and diving in a little bit about what's going on now, what are some of the things that have happened, and what are some great opportunities for the future here. So I'm David Lopez, the director from the Center for Humanitarian Engagement at Walla University, and I get to play just an active role in the volunteer side of it. But really, who you want to hear from today is Nikki, who just has this amazing title of Fix It All, Make It Happen, Walla Walla. And so, Nikki Sharp, thank you for joining us. Sam, thank you for joining us. But this is kind of what we wanted to cover today. What are we doing now? What does it look like, for our volunteer happenings, our vaccination opportunities, the testing, and what communication platform are we going to be using? And then what are some volunteer updates coming up? So that's really briefly what we're going to be diving into. And I get to start with just a plug to say thank you to all the volunteers that showed up, that participated in the annual influenza drive-through clinic. It was my very first time participating in that, but I've heard that this has happened for 12 years, and that this was the first time where we had the volunteer corps involved in the volunteer efforts. As you can see here, Commander Leathers and others getting ready for the morning to start. And let me tell you, we were supposed to start at 9 a.m. and we started at 8:23. It was early. There was people there on scooter bikes. They were there in 6, 7 people in a car having to get out to be able to get to their arms. It was just a joy to be part of it, and fun to see a lot of the volunteers that are on here as well participate. So thank you again. To be able to do that. So okay, this is some pictures. Nathan, you're highlighted there with a hot air balloon, even flying through to get their vaccine. No, they were just flying over. But it was fun, the energy that was out there. And again, just a huge thank you to the volunteers that made that happen.
Diagnosed in December 2020.
All right, so we're back to vaccinations. Nikki, what does it look like right now for options for vaccinations?
This was high grade.
All right, so our current, we've been putting a lot of our effort and energy with our contracted partner with DOH. Aristo has been helping us out at Southgate. We are open Tuesday through Saturday from 9 until 5 p.m. And we've been doing that really consistently, and we have that currently planned out through the end of the month. And our intention is to continue to offer those vaccination clinics out there, because it is a central location, a one-stop shop, if you will, in terms of a place to get your vaccination, but also individuals who are needing testing. We have a testing facility just also that people can drive up and walk up through. It is Southgate has been just a really lovely location. People, it's really easy to get the throughput. We haven't even maximized that throughput yet. So we see that we can do up to, when we're fully staffed and when people are coming through, we could probably see a 500 plus on a day. Now we have, lots of work being done there, but we also are trying to do everything we can to maximize those individuals' times, but we also are doing some other priorities. So as the boosters came online, we wanted to get to the individuals who have been perhaps vaccinated for more than 6 months and needing, that booster for a Pfizer, which is the approved booster right now. So we've been doing some outreach to our long-term care facilities who had their vaccinations through Pfizer, and we're working on doing those offshoot little clinics throughout our community to get those people who need help, whether it's our staff, whether it's people who can help with registration, et cetera. We're working with them. We have about 6 of those that we're doing in the next couple of weeks. Our next priority will be, we're working through a list of about 300 people who identified as homebound and needing vaccination of some sort. Those people we are calling, and then if Aristo, who is our partner, is able to go out on and do some vaccination with homebound residents, that's just another way for us to get to people who need that extra help and to help reduce those at high risk. So those are the first priorities as the booster came online. So mobile clinics are continuing to happen on a regular cadence in our housing programs. So our homeless shelter providers, we are trying to be really thoughtful about consistency as a key element. When people know that they have something to plan on, then maybe more that opportunity to catch them when they're maybe ready for that conversation. And so we can get to some of these other locations. Aristo has helped with some of those, but also we have our team going out on those as well. So we've been at libraries, we've been out at banks, we've been at various other places throughout Walla to try and address and catch people when they're at a place where they're maybe ready or have some time. And then those of you who know or are paying attention to the news every day, the only certain thing is a lot of change, but we know things are coming. And so we've worked with our schools, Walla Public Schools, College Place Public Schools. We have a regular call with them a couple times a week just to ensure that we're looking ahead at what's coming. And so we have put some tentative dates based on what we've heard rumor of on our calendar for school vaccinations for our individuals ages 5 to 11. Now, that means there's some dates, and that's why last call we talked specifically about trying to get 2 teams ready and willing who want to help with school vaccinations, particularly because that will take a little bit different skill sets, and we want to try to do this in a timely manner because I have a goal to try and address and get those young people the opportunity to have a vaccination before the end of the year and be fully vaccinated before the end of the year. Now, that doesn't mean that they won't have opportunities throughout the rest of time. Southgate will be an option, et cetera, but trying to get to those schools to address access and help parents, because some of the parents may be more likely to be able to come to a school versus getting down to Southgate, depending on school work schedule, et cetera. Consent is super important. And so there's just additional little steps that we want to make sure happen along the way. So those are some big vaccination needs that we have. We have some tentative dates that we'll show you here shortly. Testing. So testing is happening throughout Walla. There have been in the past some shortages, but right now we're doing that community testing center, and we're doing about 100 tests a day in about 24-hour time frame of turnaround. So that's a really nice option for people. We haven't really needed extra volunteers for that, but there are a lot of needs that we may end up continuing to be looking towards as we see people needing these additional testing requirements depending on people's vaccination discussions or some of these other things. So we may see more need for testing across our community. And then on communication, we're trying to consistently communicate to all of you and hopefully getting some regular conversation going about what our needs are so that you can plan at least a little bit ahead. We know that holidays are coming. We know that you all are busy people, and volunteerism has been such an amazing takeaway from what I have experienced with being here and working with COVID in the last year. And so I hope to just continue to consistently communicate, but that's why we're recording this, why we're streaming this, to help people know what volunteer opportunities there are coming up in the future.
Can I jump in real fast,
Yeah,
Nikki?
please jump in. Of course.
Yeah, so I did want to share, just backing up to the long-term care facilities, that part of why we're focused on it so much right now is that early on in the vaccine rollout, there was pharmacy programs where they were deploying teams and vaccine to these locations. And that hasn't been a thing for the boosters necessarily. Most of our long-term care facilities have made some plans, and we've just wanted to ensure that anyone that didn't have clinical teams or vaccine were able to get those boosters. So that was a little bit of a different thing we didn't have to worry about before that we're working on now. And then circling back to communication, one thing we're working on is getting printed materials. So possibly something in the UB again, perhaps getting some flyers posted around town. What we learned early on in the vaccine rollout was that not everyone goes onto the internet or Facebook for information, but that's what we do, and we push things that way. And so trying to use those lessons learned the first time, but always welcome ideas and feedback, because we know that's something that we needed to do better, and are hoping to do better now going forward. We have a one-stop shop kind of flyer that is going through the approval process right now that shares the dates and times for vaccinations at Southgate, and then also the dates and times for the testing site that's out at Southgate, not in urgent care, it's outside of urgent care, that we want to be sure to get out. And folks that are needing a booster dose that do not use the internet or computer regularly are welcome to walk in. Walk-ins are welcome. They can get registered on site.
Thanks, Sam. So we just an update on where we're at with vaccinations here. So what we've said, the best way out of our pandemic is, testing is not going to be the answer. It's not the only way out. It's not the way out. More fully vaccinated community percentage rate. There's all sorts of different numbers people have said. So instead of saying you have to get to this number, we're just trying to continue to increase that vaccination rate. And our overarching message, and Dr. K has said this numerous times, is that we care about everybody. And there are people out there right now who are unable to get a vaccine, and that there could be multiple reasons why. And we want those people who aren't to also know that we care about them. And we care about helping our community and protecting our community for the whole of our community. So we do want feedback. We do want to get your input on those things. So kind of recap and moving forward, in October, we've been mostly doing booster doses, and we've had some just changes in that eligibility. I'm sure there's questions people have had about eligibility. One of the main things is it's that 6 months post the second dose. So we're working on that, like kind of on that philosophical orientation. There's a ton of information on who counts as what, but our main goal is, we do want to check that 6 months date time frame. So look at your cards, find your cards, because you're going to need them, and we want to make sure people are getting that done. And then we will then continue in November working on continuing booster doses, and then youth will be, we're anticipating that youth will be approved in November, or maybe a little sooner. But again, we don't have any solid dates. And so that's why it takes, even if it gets approved, the FDA approves it, it goes to like another level, and then it goes to the state. There's like 4 or 5 steps. And so even if we were told tomorrow, we would still have some time. So please, like those of you who, we were kind of like twiddling our thumbs waiting. And so it sometimes feels like, when can we get the dose? And we wanted to put together some of these timeframes just in case, so that we have something already planned, but nothing has been set in stone. So we will adjust these dates as we need. So, but please note that that's our goal, is to get to schools, but like that, those ages will be, they may be better off having their vaccine at a pediatric clinic. They may be better off seeing at Southgate. It's what works for the parent. It works best for the kid. Each kid is different. And we've all had some interesting timeframes with like what it looks like to get all these shots. So some kids are way into it and others are not. And I think we have to find the right way and do our best. And so that's our plan, and we'll do everything we can to be intentional moving forward.
Nikki, I've got a question for you on that slide. Just looking at the eligibility for boosters right now, I know that the interest at the beginning, right, was let's get vaccines in arms, let's get it out there. Is that kind of the same with a booster, or is there a limit? Like if I qualified for the booster, should I go get it, or do I need to reserve that for other people? Where are you at with vaccines and?
Yeah, the good question, David. There's not a shortage of vaccine right now. So I think that's the important message. We're not in the first part of this. We had like the tiered systems because we only had so much vaccine that was allocated to our community. And so we did our best to get to those targeted tiered groups. And as we could order more, we would get more. And that's something we did a great job of. And so that also set us up to have a certain amount that, like, even as we request allocation, it gave us kind of an idea of what to plan for over the course of the next few months. Now, initially initially there was not a ton of vaccine created yet, and there was a lot of like demand. Now we're at this place where everyone's kind of like, well, should I get it? Is there a demand, and what do I do? So, again, looking at what those eligibility pieces are, and also like do some self-assessment as to whether or not you feel like for your needs that you look at that and make a determination based on that. Talk to your doctor, if you're questioning that, but it wouldn't be because we have a shortage of vaccine. It would be because someone chooses that they want it, or that they're in those categories that are currently recommended. Now, we have had all sorts of people come through for various reasons, and we aren't really like, there's a reason why people feel like they may be at higher risk, and higher risk of exposure is one of those kind of caveats that have been like, should consider. So these words like should, consider, they're not necessarily like hard lines, like you have to get. So I think that's another piece to be thinking about. Does that help?
Thank you. It does, very helpful. The follow-up question to that, I guess, would be, are you seeing any patterns with getting the booster? I know the first dose, some people got a little were reacting to that, right? Where the dose was working. Second dose, maybe some people had it, but some didn't. With a booster, is it a lighter experience? Or is there any kind of themes that are happening from that?
Yeah. So of my like non-scientific survey that I've done, there is, and as my own, internally in our community, et cetera, think very similar to your second dose response. Probably like that's the best option. I think you'd probably want to consider is like, if you had a response that second dose, what would you wish you had done? Maybe taking the day off. Maybe you didn't feel good. Maybe you had the achy, flu-y vibe, headache. Those are kind of the things we've seen. But depending on your immune response for the second dose, you may want to think about that as being likely for your booster.
Awesome. Thank you. I know our neighbor, 84 years old, went in and got the booster. She was thrilled to do it, pumped a lot of water, and that seemed to help her. But yeah, there's good response, I think, to that booster as well. So I think that's going to be needed going forward. Yeah.
My grandma had the same. She was like, I went through, my arm was kind of sore. I'm like, oh, good. Thank goodness it was a good response, because it doesn't feel great. I mean, still a sore arm, not the best, but that's fine. We can address that.
Nikki, along this line, we have a great question in the chat. It says, if you're a parent of a young child under the age of 12, should you get the booster? So they're exposed to lots of things in that way. So just seeing if that's an option to get the booster.
Yeah, I think the likelihood. So I think that those conversations about how our young people right now in that age group are getting consistent exposure to a lot of different things. I think because of your job, depending on your work, depending on what you're wanting to protect what your kids are exposed to, but also what can you do to, I would probably say that if it's something that you feel like you are at high risk concern, I would look at, check that list. And if you feel that's the way where you're at, and it's been 6 months since your dose, we have had a lot of, we have that not reinfection, but we've had that breakthrough cases on those individuals who've been fully vaccinated. And, the idea of being protected and not having to isolate and quarantine, this just gives that extra layer of at least I'm doing what I can so that I don't get sick. So then I could, send my kid to school, and my kid goes to school and is at risk of maybe didn't know or wasn't symptomatic. So bringing it home or vice versa.
Thank you, Nikki. And just a reminder, we are monitoring the chat if you have any questions.
Yeah, I think good questions are helpful, and I do want to, as we look at these, there might be some additional like town halls, like from Dr. K. And I'm not a medical professional. I do everything I can to listen, but I would prefer people like definitely seek out speaking with their medical provider about their needs as well, because boy, there's a lot to take on, and we want people to feel like they have the resources. Anything else on those? All right, so below or attached to it, you'll see this is some tentative school clinics from Walla Public Schools and College Place Public Schools. We've set out Burbank, Touchy, Prescott, and Waitsburg. We have some, their clinics were, when we did them before, we're learning again, like learn from what you experienced the first time. So we will have those clinics, but they might be smaller in terms of scope and scale. What we look at with these particular groups, we had upwards of 9 volunteers at each of those clinics, including our staff. And then we had school staff who helped with those vaccinations at middle school and high school. So we're kind of taking that model and saying that's a pretty significant need. And that's why we're looking for 2 teams, basically, or trying to like piece together these groups to help us address, those particular clinics. Because if we're like, oh, wow, it's only this many clinic days, then it might be helpful for people like, okay, we can work on these 2 and get them done. And so that's kind of our hope and strategy is look ahead, say, okay, I could do these and be that consistent person there. Obviously, this is going to be Pfizer, and it would be, that's why we're looking at 2 doses.
Great work, Nikki. This is great. I mean, so this gets us into, I should have counted them earlier, but 7 schools, 6, 7 schools. That's a lot of
2, 3, 4, 5, 6, 7, 8, 9,
wow.
10, 11, 12, 13.
Okay.
So yeah, it'll be like 12 schools for sure.
Yeah.
And again, going back to, I appreciate the desire for equitability and access. So while Walla and College Place are obviously like bigger school districts, but we do not want to ignore our outskirts schools, and those are going to be part of that. So this is why we don't want to just like pigeonhole and say we're only going to do these. We want to get to our other communities.
Perfect. And just as a reminder for everybody that's watching or participating here, we did do an email out asking, are you comfortable to the vaccinators, right? Are you comfortable working with pediatrics? And so we do have, if you responded to that email, I do have that list, and we are going to be contacting you first to try to get you plugged into this calendar as soon as we have the go ahead. Right now, this is a tentative schedule. This is a wish, this is ready with the schools to work on, but we don't have that FDA approval yet, right? Thank you. As soon as we have that, we'll build out those clinics and let you know.
Yeah, I think as we have approval, then we have an ability to start to plan ahead. The first is FDA, then it goes to CDC, then it goes to the states, then it goes, once the states have, like, there's a specific one for Washington, and they have to do another approval. And even at that point, we want to make sure that our, the health, like the order, the standing orders are updated. So there's a old image that Bryce, one of our communications person, put out, that when we had the boosters approved, it had like a series of check marks, like this is the process that takes. So one step does not make the whole thing happen. So we gotta wait and see. But I do think there's a lot of energy around this. So
that's really helpful. So then based on when that does come through, this would just be a rolling schedule. So if it came through on the 16th, we would do a clinic on the 17th and then reschedule those other 3 days to a later date. Is that kind of
that's kind of the idea? And then and based on what the training is, and hopefully we'll have a little bit more knowledge of what that looks like. And just so everyone knows, we don't want to just cancel a bunch of clinics. I'm sure, show of hands, you might have had a clinic that we thought we were going to do and it got canceled, or you showed up and wanted to help and you didn't get to do it. So we don't want to overuse, we want to be strategic. And so hopefully this might help us plan a little bit further ahead. And again, these are tentative dates. So current needs that we've kind of identified. Spanish speaking volunteers at Southgate clinics. So Tuesday through Saturday, 9 to 5, we've just been noticing the need at times when individuals come in. And if a staff member from our Aristo team doesn't speak Spanish, it's just an important experience to have, like, feel well taken care of and walk through the process. And so we're, exploring needs for Spanish speaking volunteers for that. And those are Tuesday through Saturday. Then also clinical teams for mobile vaccination clinics, so long-term care facilities, and then school clinics. We're kind of looking at trying to have like 2 teams was my thought. We're like, okay, we'll get 2 teams because there's one day, a couple days that we're actually going to be at 2 different elementary schools and at the same time. And so if we had 2 teams, then we could get to more people in a given day instead of trying to chase and be at 3 places at once. It's not really, like set up and take down 3 times is just a lot. So, and then we've talked a little bit about some social workers that can join our clinical teams on mobile vaccination efforts, just to talk about that vaccine hesitancy, just people feeling like they have a lot of questions. And again, like, we're here to walk alongside people. We're not here to like say, hey, it's great up here, or we know more than you. It's more about like, we're on this journey and kind of looking ahead of what we want to, life to look like, and how do we build a life that also, now includes COVID as part of our life. So future.
One more question on the Spanish. How good do they need to speak? Like, what level of Spanish is this? They have to have a medical certificate, or is this somebody that can just translate basic, what's your name, and fill out a form?
I'd love for someone who's just willing and able to, walk through someone through that. I think there's that additional extra level of expertise that we can kind of phone a friend and get that extra layer of medical translation if needed. But we'd rather, utilize people who have that skill set if they are willing.
Yeah, so just to clarify, we don't need a certificate of a medical training to be able to do that translation. It's just if you speak Spanish, if you can help us communicate well with a individual in their language, make them feel comfortable. I think that's going to be a really important piece as we spread the vaccine in this positive way. So cool, thank you.
Yeah. So I think I can say some of these things, but do you want to say these future meeting approaches, David, or I can totally still say it. I just want people to know we want to talk regularly. We don't want people to be like caught off guard. So this way, hopefully people can find what's going on and feel like they could ask questions or know where to go if they have questions. Thank you.
Yeah, that's basically it, Nikki. Good job. I think we basically want to be able to offer communication. So we're going to be doing that through email updates, but even more so, I think we'll have these every other Wednesday, 2nd and 4th Wednesdays of the month at noon for 30 minutes, and the recordings will be available online. And so we hope that this is useful. We'd like to have some polls and maybe some other more interactive times in the future, but time got away with us this time. But thank you so much for joining, Nikki. Thank you so much for all the content, Sam, for putting together this PowerPoint, and everyone for your good questions and attention to the details. I look forward to working with you more as through the Volunteer Corps, and we'll stay in touch.
Thank you, everybody.
Yeah, thank you.
Hey, Nikki, can you send out your slides?
Oh, yes, we can. Yeah, we can send the slides.
Great, thanks.